employee benefits are an incredibly sensitive topic, and the way employee benefits are handled really depends in large part on the culture of an individual organization. And so our view is we have to be able to meet the employers where they are. So can we offer a full replacement, high-performing, narrow-ish network to an employer? Absolutely. Do we have alternatives that are available where we can wrap with supplemental networks beyond what's in our core? Yes, and we're willing to do so if the speed and pace of disruption is too much for an organization to digest, say, in year one. Are we willing to be a side-by-side choice so that you don't force the employees over to the new product, but maybe you incentivize it with some creative plan design choices, like things around copays and deductibles? Absolutely. So our view is, we've got to be open to meeting the employers where they are and provide them the flexibility to adopt the solution in a way that will help them realize the savings that are inherent in what we've designed, but that are also consistent with their cultural values. And then the last thing that I would sort of say here is that, our view is we want to take the friction out of the experience of healthcare. And that's something we can do in a much more targeted way by creating access to navigation programs and care management solutions that we've built specific to these employer populations that make navigating, let's be frank, a very complex healthcare system a whole heck of a lot easier. And we think that experiential benefit is really valuable. And we say, I say that with confidence because we've built these capabilities and we've used them for our own workforce. And as a Fortune 100 rated best place to work 3 years in a row, we've seen the value that it's created for our own workforce and believe strongly that there's a value prop in that experience component for these employers.
Josh, I know you have some thoughts as well, and you've implemented quite a few of those plans that Nick had talked about, where you're wrapping around like a national network. Can you talk more about that?
Yeah, it's an area that's evolved a lot over the last 3 years with the growth of direct contracting. And so we've actually created a solution in the last year with one of the national BUCA carriers. BUCA, for those who might not know, is Blue Cross, United, Cigna, and Humana. So the big 5 carriers in the country. And so now we've got the alternative to provide the high performance, narrower network access of providers in addition to a national access channel. And in some cases, they're the same plan option. And in other cases, it's a dual option where the individual has a choice to go either to the narrow solution or the broad-based solution. And that hybrid model where it could be in the same plan is a very new innovation in the marketplace. And so it's something, to Nick's earlier point, needed to happen because the culture of the organizations and of the individuals themselves are traditionally aware of the fact that they can go many places for care through PPO networks. Kaiser's the one exception, right? Kaiser is the traditional narrow network. Their national quality standards are phenomenal because of that. So to Nick's earlier point, when you've got like Northwell Health has an integrated care network, so they're sharing medical records throughout the system, there's huge value to that, to the member. And that's what Kaiser has always kind of hung their hat on. And so that's all of these pieces are intersecting in the marriage of the national traditional networks and the narrow solutions. And it's a really exciting time to watch the evolution of how providers, employers, and health plans are coming together to really try to leverage the tools that are available today in the oncoming transparency wave that is hitting us to really define new solutions to historical problems.